Thyroid cancer is a type of cancer that develops in the thyroid gland, a butterfly-shaped gland located at the base of the neck. The thyroid produces hormones that regulate metabolism, energy levels, and overall growth and development. Thyroid cancer can occur in different forms, and its prognosis and treatment vary depending on the specific type and stage of the cancer. Types of thyroid cancer. There are several types of thyroid cancer, categorized mainly into two groups: differentiated thyroid cancers and anaplastic thyroid cancers. Differentiated thyroid cancers. Papillary thyroid cancer, the most common type, accounting for about 80% of thyroid cancer cases. It typically grows slowly and often spreads to lymph nodes but usually has a good prognosis. Follicular thyroid cancer. This type is less common, comprising about 10 to 15% of cases. It can be more aggressive than papillary cancer and may spread to other parts of the body, such as the lungs or bones. Hurtful cell carcinoma, the rare subtype of follicular thyroid cancer, it may be more challenging to treat and tends to be more aggressive. Medullary thyroid cancer (MTC) accounts for about 3 to 5% of thyroid cancers. It arises from parafollicular cells, C cells that produce calcitonin. MTC can be sporadic or hereditary, with the latter often associated with multiple endocrine neoplasia (MEN) syndromes. Anaplastic thyroid cancer, the rare and aggressive form that occurs in older adults. It tends to grow rapidly and can be challenging to treat, often requiring a combination of surgery, radiation, and chemotherapy. Risk factors. Several risk factors may increase the likelihood of developing thyroid cancer, including age, most common in adults aged 30 to 60, although it can occur at any age. Gender. Women are more likely than men to develop thyroid cancer. Family history. The family history of thyroid cancer or genetic syndromes, such as MEN2A or 2B, increases the risk. Radiation exposure. Previous exposure to radiation, particularly in the neck area e.g., from radiation therapy for other cancers, can elevate risk. Iodine deficiency. Low iodine levels in the diet can increase the risk of certain types of thyroid cancer. Symptoms. Thyroid cancer may not cause noticeable symptoms in its early stages. As the cancer progresses, symptoms may include lump or nodule, a noticeable lump or swelling in the neck that may be painless. Changes in voice, hoarseness or changes in voice quality due to pressure on the laryngeal nerves. Difficulty swallowing. As the tumor grows, it may compress the esophagus, causing swallowing difficulties. Breathing difficulties. Large tumors can obstruct the trachea, leading to breathing issues. Swollen lymph nodes. Lymph nodes in the neck may become enlarged if the cancer spreads. Diagnosis. Diagnosis of thyroid cancer typically involves several steps. Physical examination. Healthcare provider will assess the neck for lumps or abnormalities. Imaging tests. Ultrasound. A thyroid ultrasound can help visualize nodules and assess their characteristics. CT or MRI scans may be used to evaluate larger tumors and assess if they have spread. Fine needle aspiration biopsy (FNA). A thin needle is used to extract cells from a thyroid nodule for laboratory analysis to determine if cancer is present. Blood tests. Measuring levels of thyroid hormones T3 and T4 and thyroid-stimulating hormone TSH can help assess thyroid function, although these are not definitive for cancer diagnosis. Treatment. Treatment options for thyroid cancer vary based on the type, stage, and individual patient factors. Common treatment modalities include surgery. Thyroidectomy. Removal of all or part of the thyroid gland is the primary treatment for most thyroid cancers. Lymph node dissection. Removal of nearby lymph nodes may be performed if cancer has spread. Radioactive iodine therapy, often used after surgery, particularly for papillary and follicular thyroid cancers. It involves administering radioactive iodine to destroy any remaining cancer cells. External beam radiation therapy. This may be used for anaplastic thyroid cancer or in cases where the cancer has spread and surgery is not an option. Chemotherapy, generally less effective for thyroid cancer but may be used in certain cases of aggressive forms, especially anaplastic thyroid cancer. Targeted therapy, medications that specifically target cancer cell mutations or pathways may be used, particularly for medullary thyroid cancer. Prognosis. The prognosis for thyroid cancer varies significantly based on the type and stage at diagnosis. Papillary and follicular thyroid cancer generally have excellent prognosis with high survival rates, especially when diagnosed early. Medullary thyroid cancer prognosis depends on the stage at diagnosis. Early detection and treatment can improve outcomes. Anaplastic thyroid cancer. This type tends to have a poor prognosis due to its aggressive nature and tendency to spread rapidly. Follow-up care. Regular follow-up is essential after treatment to monitor for recurrence. This may involve thyroid function tests, regular blood tests to check thyroid hormone levels and adjust medication as necessary, ultrasound monitoring to check for the presence of nodules or any signs of recurrence. Conclusion. Thyroid cancer is a complex condition with various types and treatment options. Early detection and treatment are crucial for improving outcomes. If you notice any unusual lumps or symptoms in your neck, it is essential to consult a healthcare professional for evaluation and potential diagnosis. With appropriate management, many individuals with thyroid cancer can lead healthy lives following treatment.